I remember during my third year, just as I was starting my clinical rounds, I met a patient who had perfectly functional eyes, but he had lost his sight in both eyes due to diabetes, a disease we see so often in our everyday life. I didn't even know this was possible, losing your vision to diabetes. He couldn't take all the treatment he needed simply because he couldn't afford it. And it wasn't just him I saw that day. His wife was standing right next to him, holding his hand. His little child, barely 2 or 3 years old, was running around, laughing, unaware that the world had just shifted for their entire family. The playful poor child did not even understand what blindness meant. I remember feeling so helpless. I wanted to do something to save his vision, from saving his poor family from losing the only breadwinner of the family. But I could not. It was the first time I truly understood how fragile life is and how medicine isn't just science, it's actual human lives. My 20-year-old self joined med school thinking it was going to be all about learning anatomy, physiology of life, or just passing exams. But slowly with time, I realized med school doesn't just teach you medicine, anatomy, and physiology, it teaches you how to see the world differently, how to feel deeply, how to carry both knowledge and compassion. It changes you in ways you never really expected. It also taught me something that we are so wrong into thinking, that we don't need anybody in our lives, that we are just as self sufficient as it is. But when you see patients along with their wives and families and children standing right beside them, feeding them, taking care of them when they are ill, when they're throwing up, when they can't even walk themselves, you realize that human connections are so important. And that mentality that you can survive life alone just by yourself starts to fade away when you see how important these human connections really are. Med school stretches you beyond your own limits. You fail, you stumble, you doubt yourself, and yet, for some reason, you keep on going. It teaches resilience, the kind that stays with you long after the exams are over. And suddenly, the weight of responsibility settles in. It's heavy, it's constant, and sometimes suffocating. Every fact you memorize, every skill you practice might one day save a life. And then you stop seeing people just as symptoms. You begin to see people for who they really are. Their stories, their struggles, and their fears become your own. You understand that every person is fighting battles you can't see, and your judgment gives way to compassion. You witness people struggle, recover, or pass away, and suddenly the worldly, trivial worries seem so meaningless. You also realize how horrible and lacking the healthcare system of a country can be. And I hope from the deepest core of my heart that this new generation of doctors and med students can change this healthcare system for the better, and they become the most kind, compassionate human beings, and they learn how to value life, how to grow, not just as doctors, but as a human being. And that is a lesson I'll carry forever. Because at the end of the day, med school teaches you that sometimes being human is the greatest lesson of all.